All right, everyone, we're going to go ahead and get started so we have as much time as possible. Welcome, everyone, to day 3 of our BenU Annual Public Health Conference put on by Benedictine University and the Public Health Student Organization. We are really excited to welcome all of you today to our day 3 Public Health Internship and Career Opportunities session. We have a lot of great organizations represented here today who we have representatives from several organizations that are excited to talk to you about roles that public health professionals and interns have in their organizations and to talk to you about potential opportunities in their organizations. So this is going to be a really great session and we're excited to have all of them here. And we thank them for their time and generosity and offering their time to be here and everything. So we're really excited about it. So thank you all so much. Maria, if you want to move to the next slide. Awesome. So basically how it'll work today is we'll have each of the organizations sort of talk about their organizations and introduce themselves, and then obviously talk about some opportunities in their organizations. We'll then move on to some questions that we've prepared to help you guys better, better get to know the organizations and potential opportunities there. And then we will open it up to all of you to ask questions. And please remember to remain muted throughout this to be respectful of our panelists, and we will definitely have a Q&A at the end. So any questions that you have during the session, please feel free to put it into the chat. We will be keeping an eye on it so that we can ask those questions. And then at the end too, we will allow you to unmute yourselves and ask those questions as well. So we have 7 different organizations here that are represented. We have Sunbelt Staffing, American Academy of Pediatrics, Nova Scripps Central, Ura Resource Center, LLC, the Peace Corps, American Association of Nurse Anesthetists, and the CDC PHI Fellowship. So this is a great array of organizations that are represented here. And so we're just going to go ahead and jump in to our first organization from Sunbelt. They are a recruiting organization and they recruit a lot of public health positions. And we have Emily here representing them. So Emily, if you want to take it away, and the floor is yours.
Hi, I'm Emily Janacek. I work with Sunbelt Staffing. I am a national hiring manager. We hire several healthcare contract positions around the country, and we do public health positions in the city of Chicago. So I just kind of wanted to go over some things about our jobs and what we look for with our position. I am going to share my screen. Is that all right? Are you able to see it? Okay. A guide to some of our public health jobs. Since they are contract positions, they are looking for relevant experience for these positions. So we have several positions like epidemiologists, public health administrators, project managers, public health data entry operators, medical assistants, registered nurses, etc. So we're looking for relevant internships while you're doing your master's of public health. So it's very important, do whatever you can to get an internship or volunteer wherever you want your goals and your career path to go. So that's very important. Choose volunteering based on your career goals. You can do a lot of volunteering, but that's a lot of time, and you want it to be relevant to what you want to do in the future. Get a job in healthcare. Like sometimes when we're in school, we keep working the same job throughout undergrad and our master's, maybe at a bar and restaurant, maybe at Target, but it is very important to get that healthcare experience. So see if you could take a 6-week CNA course and work in the hospitals, the nursing homes. Do anything you can to get healthcare experience. And another thing that's very important is networking. So go to public health networking events, volunteer. You can meet people who work in the public health industry and network and get to know them, and internships as well. Those are all really important in getting jobs in public health. Sometimes it really is who you know, and when they see your hard work and your work ethic, that can get you a future position once you graduate. Some of the resume tips I have when we look for public health individuals to work in public health, since we do contract positions, we need resumes to be a certain way. So one thing that's really important is use a Word document. Just make them standard. Don't use templates or graphics. Don't have your pictures on them. Don't make them colorful. Just a standard Word document. And whatever position you're applying for, you want to make sure that you are looking at that job description and you're tailoring your resume to that. And you want to add all relevant experience that you have on your resume. You want to add all of your projects, your internships, and your volunteering to that position. So if you've worked in, say you want to do community-based outreach, you want to do your internships and volunteer in that area, and you want to make sure you put all of that relevant experience that matches the job that you're looking for. You do want to add your software experience. So under each project you've done or position that you've worked in, you want to add it like your SAS or your REDCap or R. You want to put that all under each project that you've used those. You don't want like at the very bottom, it just to say skills. They want to see where you've utilized those skills. And always keep your resumes under 2 pages. I know CVs can be very long. You can have all your publications, but for contract positions that we're looking for public health, and when we send them over to the public health officials, then they want to be able to breeze through and read all of your relevant experience for that. And then I do have a list that I can hand out. It's all of our current jobs that we do have open. So we can send that out at the end, and there's links on there, and you can just apply through those positions once this is over. And that is it.
Awesome. Thank you so much, Emily. We're going to move to the next organization, American Academy of Pediatrics. And we have Karen and Sue from American Academy of Pediatrics.
Oh, hold on. Go back. Well, just leave it.
Sorry, technical.
So thank you for having us today. Sue and myself make up the recruitment team at the American Academy of Pediatrics. We're going to provide you with some background information about who we are. We are, okay, next slide. There we go. Next slide. Okay, spacebar. Spacebar. There we go. All right, so the AAP is a professional membership organization for pediatricians. We have a little over 67,000 pediatrician members that belong to our organization. In addition to that, we have other pediatric subspecialty people that are also members, like might not be a pediatrician, but a cardiac, pediatric, cardiology or a NICU nurse would also fall into this category. Spacebar. The mission of the organization is to attain optimal mental, social health, and well-being for all infants, children, adolescents, and young adults. Spacebar. We have about 465 staff members. Our headquarter office is in Itasca, where a majority of our staff are. And then we have a small office in Washington, D.C. of about 15, 16 staff members that are federal advocacy and are located out there to be by Capitol Hill. Spacebar. So since 2005, every year, the Academy has been named one of the 101 best and brightest companies to work for in the Chicagoland area. Spacebar. And in addition to that, we've also been recognized as the best adoption-friendly workplace, national best and brightest in wellness activities for our employees, and the best and brightest companies to work for in the nation. Now we're going to talk about some of the public health focused areas at the organization.
Right, so I wanted to share a little bit of information about the top two. So the first one I'll talk about is the Healthy, Resilient Children, Youth, and Families area. They focus on improving systems of care for all children and youth, especially children with special health care needs. Some of the focus areas include asthma, allergies, autism, epilepsy, screening and preventing birth defects, including early hearing interventions, and alcohol spectrum disorders. And then another team underneath Healthy, Resilient Children, Youth, and Families is the Pediatric Population Health team. They focus on disease prevention, so adolescent health, tobacco control, pediatric environmental health, which is the national network of experts that work to prevent health issues resulting from environmental exposure. There's also a COVID-19 training center for pediatricians. And so we just added that team from CDC funding that we received. So that was an addition this year. And also Project ECHO is another team that's been a longstanding group. They work to connect pediatricians from rural areas with specialists by using telehealth technology. So that's one of the groups. Another team underneath the Healthy, Resilient Children, Youth, and Families is the Child and Community Health, and they train doctors to work in their communities and advocate on behalf of children's health at the local, state, and federal level. So they focus on injuries, violence and poison prevention, school health, managing social determinants of health, so all of the food insecurities, safe housing, access to affordable health care, bright futures, guidance for preventative screenings, and also pediatric obesity prevention. So the next category I'd like to talk about is primary care and subspecialty pediatrics. And their main function is to help pediatricians run more effective business, keep members up to date on breaking healthcare news. So this is where our immunization team is. Obviously, they're really busy these days dealing with COVID-19 pandemic response. There's also a maternal and child health initiatives team, and there is the NICU verification program, which is fighting the rising rates of preemies in the U.S. So I'll hand it over to Karen to talk about the next two areas.
Sure. So global child health and life support. The global child health portion is more programmatic work, and the life support portion is more training aspect. So the global child health is the programmatic side. Their focus is engaging in globally with pediatric societies around the world to enhance clinicians' abilities to improve health of children and families, such as promoting early childhood development. We do have a global business development team that's generating revenue for these different global products and trainings that we put on. The life support has a training side that focuses on education, the implementation, and then doing research and evaluation of those products and programs that we put out. And then we have a simulation team, which utilizes lifelike robots that look like human beings from infants all the way up to young adults in order to train clinicians on different aspects of their job. A lot of programs come out of this area, like the neonatal resuscitation program, life support, or the advanced pediatric life support, helping babies survive, pediatric education for pre-hospital professionals, pediatric first aid for caregivers and teachers, and babysitter lessons and safety training.
Oh, Karen, I think.
Yeah,
you're muted.
accidentally got hit. Our last section, equity initiatives. This is obviously a new area of the organization. We've always had it, but now it has branched off into its own area. It is a team of 2. We started this team of 2 about 3.5 years ago. We are currently doubling it. We are hiring 2 new positions right now in our equity area. Their focus is providing oversight of the AAP's efforts to be more diverse, inclusive, and equitable, filtering that to each of our groups, our committees, our councils, our sections, all of our program area to make sure it's all in a consistent fashion. They're addressing health equity and racism. And then next slide.
And so I will talk about the grant funding for our grants. The majority of our public health positions are grant funded. We always guarantee 1 year from funding from the date of hire. And in addition to that, the funding pretty much, grant funded just means that there's money that is coming from an outside entity to help support that position. So that can come from a variety of different entities. The federal government, CDC, for example, corporations, Pfizer Pharmaceuticals has provided funding, other nonprofits like the Bill and Melinda Gates Foundation. So all of our positions are guaranteed the first year to have funding. All of our projects can range. It depends on the funder, anywhere between 1 to 5 years. It could extend beyond that, continuation. And once the funding wraps up, if not additional funding is obtained, then the position will be eliminated. However, we do like to hire from within, and we post all of our positions internally. And in addition to having that 1 year of funding guarantee, all grant employees are eligible for our full benefits. Again, the next slide.
So this is our beautiful headquarters in Itasca. To view any of our employment opportunities, other information about the organization or our benefits, you can go to our career center that's listed here. As Sue mentioned, we do like to hire from within. So all positions are posted internally first, as we like to move our staff to other opportunities for growth. In a fiscal year, we're nearing about 50% of our staff are getting our positions. So that's a pretty good number. Next slide. Internship opportunities. These, I'll be honest, are kind of few and far between, but we are trying to expand that area. Internships have to be for course credit, and you would all be applicable because you need to go to a accredited college or university, which you do. We have been giving our internship opportunities to our staff first. We have a lot of staff that are pursuing their MPHs right now. And if they need to do an internship, we are going to honor them an opportunity within the organization to do so first. That's one reason why they're a little bit few and far between. So you don't have to have your MPH already. You can still work for the organization. We hire from high school grad all the way up to MD and everything in between. So if you don't actually have your MPH yet, we still have positions for you. We do have an internship opportunity for the summer coming up. It just got approved today. So when I have all the information, I will be sharing it with Benedictine. So if anyone's interested in the opportunity, they can apply. And then last slide. Please feel free to connect with Sue and I on LinkedIn. We love connecting with individuals, and I know there's opportunity for questions tonight, but if you have any questions after today, please utilize our email address that we provided, and we'll be happy to get back with you. And that is it. Thank you.
All right, thank you so much, Sue and Karen. That was a great summary, and thanks for going through the different parts of your organization and the different opportunities that are available. So thank you for that. We're going to move to our next organization here. We have NovaScript Central, and we have Dr. John and Maria representing NovaScript Central. So the floor is yours.
Hi, everyone. Thank you for giving us an opportunity to kind of join you today. So NovaScript Central, we are a nonprofit based in Falls Church, Virginia, so right outside of DC. Our mission, as stated, is to provide life-saving medication to those in need. But we provide a very unique approach to our services. Not only are we providing life-saving medicine, but we're really focused on providing life-saving education and resources to the community at large. Majority of our patients that we serve are 300% below the federal poverty level, work 2 to 3 jobs, and suffer from complex medical issues. We offer a variety of different programs ranging from school-based immunizations, providing medicines to manage chronic illness. We do a ton of health education where we go into libraries, churches, any public venue to teach children, adults, and seniors about a variety of health topics. Our big focus when we do education is that cultural competency and health literacy focus. We really want to make sure that the community understands their health needs so that they're more empowered to really act upon it. We also have a variety of different resources that we help to kind of link people up. We work with about 16 different clinics located throughout our region, the Northern Virginia area region, so we can direct people that have no insurance to one of our clinic partners to get medical care. And those that do have insurance, we kind of highlight how to use insurance, because just because somebody's insured doesn't mean they know how to use it. And part of our focus is really how do we eliminate barriers and empower individuals to be independent in terms of their own health care. You know, we've been taking students from Benedictine for the past few years, and we've had such a great experience, and we're excited to bring on another intern for this upcoming year. As someone alluded to, people like to hire within, and internships lead to job opportunities. And I could say for one, and Maria can attest to it, we do like to hire the interns that we train, because if we're committing time to you to train you in the way that we want, then the goal is to hopefully be able to retain you post-graduation once you complete your program, or at least direct you in different career opportunities, especially because we are in the DC area. We're pretty well connected from an advocacy standpoint, and I sit on a lot of different committees, both nationally, regionally, and locally, focused on health disparities work, whether it's looking at health equity in terms of genomic research, looking at housing issues. We do a lot of advocacy around a variety of different public health issues. Maria, do you want to just talk about your experience?
Yeah. Good evening. I am Maria. I am an alumna of Benedictine University. I graduated in August 2019 with a master's degree in public health. I earned a dual certificate, certificate in health management and policy, and certificate in epidemiology. I applied to have my internship into 2 institutions. One is in the local health department. And when I chanced upon the list of affiliated organization, I saw NovaScript Central. So I thought like this is different. So I was interviewed by both, but I chose NovaScript Central because I thought I want to learn something that I do not know yet. And during my internship, Dr. John sent me to symposiums and conferences in DC. And then I really went out into the community. And from there, I really saw the reality of public health and met those people that we talked about during our social determinants of health lecture. I talked to them, I interviewed them, I worked with them. And while doing that, I worked on developing our educational handouts for the community. I assisted in one of NovaScript's health programs for the diabetic patients and so much more. While I was doing that, I was finishing my capstone project, which is what we call an immunization passport. That is a template to keep the immunization records and educational booklets that is geared for school-aged children who were entering the Fairfax County, who were taking or getting their vaccines for school enrollment in Fairfax County in the DC area. And then before my internship ended, Dr. John offered me a position in NovaScripts as their medical research coordinator. And then from there, I gradually took on bigger tasks such as data collection, developing data collection tools, measuring the impact of our health program to the community, more on epidemiology like the data visualization and data analytics. And from there, I realized that MPH is not really defined by one job description, especially if you find your niche and passion. So before I end my short story and my experience with internship, I wanted to let my future co-alumni know that if you set your internship goal, aim to do more. I mean, aim to go beyond what you plan to learn, because public health is really a limitless science. There are a lot of avenues to go into. It is just up to us where we want to go and what we want to achieve. So thank you for inviting us and letting us talk about our organization, and good evening.
So, kind of what Maria alluded to, one of the things that we really focus on is looking at how can you have an impact regardless of the title you have. At the end of the day, we're focused on how do we add value and really impact the lives of those around us. We work on so many different levels to kind of work behind the scenes at the core issues that are challenging communities. There are a lot of buzzwords in the public health space where we talk about social determinants of health, health disparities, health equity, but those are just buzzwords unless you have action behind it. So when we work on projects, we really focused on tangible outcomes, results, and how can we take the learned experiences that we have from Virginia and share with others around the country, because other communities are facing the same exact challenges. I used to be in academia, so NovaScript Central is a huge training facility for a lot of students, whether it's going to be nursing students, pharmacy students, physicians. I've trained thousands of people from all disciplines, but my focus at the end of the day, every single student will tell you, is I just want to know how are you getting a job, because at the end of the day, education is great, but you need to get an education to work towards making a difference. So we try to focus on those tangible skills and give projects that are relevant to that. And we really work with a lot of national organizations on those advocacy efforts, whether it be data visualization, which is something that Maria is really kind of taking the lead on, is how do we tell the story through data? We have collection of information about census level data. We have data from patient surveys, but we need to tell the story so that people can be motivated to actually commit to change. Next slide. So one of the projects, that we want to focus on, especially if we are able to get a new intern for this upcoming year, is to really focus on medication affordability and safety. When we look at the cost of prescription drugs, it is one of the most expensive things that comes in terms of patient care. A lot of people will think, let me just get patients to the doctor's office. But we always say, what good is a diagnosis if you can't afford the treatment? So we get the patient to see a doctor or a nurse practitioner for their asthma. But then that asthma medication that they're told that they need is $300. They can't afford it. So now what happens? The clinicians feel great because they were able to provide access to care, see that patient, but then that patient goes home without their medicine and they're still back at square one. Or if they go to the pharmacy may give the medicine and the patient doesn't know how to use it because they don't speak English, or they can't read, or they just were embarrassed to ask questions. So you really need to focus on, how do you engage those patients to really understand? What our focus with this project is, given 45 million Americans lost their jobs due to COVID this past year, a lot of people still had issues with health concerns and finding affordable medications. So in healthcare, people do try to price shop. Unfortunately, it's not like Hayek where you look for the best deal for an airline ticket to take your friends or family on a vacation. Healthcare is a lot more specific. It has to have a lot more intricate moving parts that are considered when you're making that decision. When it comes to medication affordability, they are trying to survive. They are trying to figure out, how do I afford my food, my rent, and the medicines to manage my illness? So the example I gave you, so imagine a patient that has suffered from diabetes, high blood pressure, and mental health, and they need to afford their medicines to manage all these conditions. The problem is patients are easily confused as to where to look. And because we have ads highlighted, there's pharma assistance, there's GoodRx, there are all these different programs out there, it creates an incomplete story of that patient for the provider. So when the medical team, especially a pharmacist, is looking at, do I have the full medication profile of this individual? Are there any drug interactions? It's very limiting when we can't get the full report from the patient, but also if the computer system doesn't keep track of it. So if somebody goes to a Walgreens, CVS, and a Rite Aid, there are 3 different companies completely. People are price shopping, and then none of these 3 stores have your full picture. What we want to look at is, how do we know if patients are really getting a good deal from the pharmacies? You know, if they're using GoodRx, is this the best discount opportunity available? You know, is there a place where maybe instead of going to the CVS 20 miles away to get my insulin, can I go to another store to get my free diabetes medication? Can I go to another store to get my supplements? Well, maybe there's one store you can get everything out. That makes it more focused on that patient's safety. Because what we're worried about is something called polypharmacy, where when people have too many medications because they're taking one drug for a side effect that the other drug is causing, but nobody knows about it. And when we come to uninsured patients, people that are working, 2 to 3 jobs, working below the federal poverty level, they don't have the resources or the time, to go and really look into this stuff. And that's what we want to really focus on. How can we really advocate for educating patients regarding the drugs, these cost saving programs that are out there? But at the same point, we want to focus on what's the impact on patient safety. Have we seen an incidence in terms of more hospitalizations because everybody was price shopping between going to one venue versus another venue? And so there's a lot in terms of awareness that we want to do. Ideally, we'd like to do a white paper, based on the expertise of the students and our team, to really shed light on this. Because at the end of the day, medicines aren't going to get cheaper. Unfortunately, America is very medicated by nature. And, COVID has caused a lot more complications, meaning that more people will need drugs, but also need to know how to manage their medical needs outside of medications alone. As a nonprofit pharmacy, I would like to dispense less medicine and really empower people to be healthy on their own. But the only way we can do that is really kind of meeting them where they are and focusing on the core principles of treating people as humans and really making sure that their needs are met without any, other, convoluted focus areas. And that's the beauty about being a nonprofit. We're not profit driven. We're really focused on, patient care, empowering our communities, and really focusing on make sure they understand what's going on. I am blessed to have a very culturally diverse staff with excellent team members that speak a variety of different languages. So when we do our education, we really go through researching what are the social stigmas around the different health topics, whether it be mental health, immunizations, cancer, whatever topic it is. We need to know from the community, what are they concerned about? So we address it head on. We don't wait for the community to tell us, hey, I heard about this, because somebody may not know how to approach that conversation. So we're usually knowing, all right, we've done the homework. We know what people are saying on the streets. Let's address it head on so people feel comfortable. And the one thing I tell all my students is that at the end of the day of our workshops, people need to go home and say they talked to a crazy person. The reason why I say that is that when you go home, historically, education for healthcare is always focused on a one-on-one conversation. And when that individual goes home, they may not have the ability to get support from their friends or loved ones. So when someone asks you, well, how was your day today? And you said, it was fine. I went to a great workshop and it was wonderful. Then there's no other follow-up questions about your day. They just go about, oh, the weather tomorrow or this or that. But if you said you spoke to a crazy person, immediately, what happened? Are you okay? There's all these follow-up questions. Now there's an opportunity to have a dialogue with the rest of your friends and family about, what did you learn that day? What was so shocking that made you think twice about it? And then the friends and family can have conversations. You know what? That's not actually that crazy of an idea. They told you not to eat rice for breakfast. Why are you eating rice in the first place? I don't know. I just like it. But now you're building that support system. So it's the same way that we look at smoking cessation. If you try to get a smoker to quit independently, you're not successful. But if you're able to help them create a support network, you are 10 times more likely to be successful in order to get them to quit. So I appreciate the opportunity to speak with all of you tonight. My contact information, Maria's contact information is there. And I hope to have an intern join us to work on our research project as their capstone.
Awesome. Thank you so much, Dr. John and Maria. We're going to move on to our next organization here. We have Latanya from Ura Resource Center, LLC. Latanya, go ahead.
Hello, everyone. Can you hear me? Thumbs up. Drop a 1 in the chat room if you're having a great time and you're learning some great things from the presenter so far. I know I'm learning, and I'm also Googling things. Yes, yes, yes. Yes, 1111. Yeah, so these opportunities are great. And I just remember in 2016, when I was, finishing up my master's in public health program, I wish there was something like this available to me. So you guys are really, really blessed to have such a presentation. My name is Latanya Bynum. I bring you greetings from Arkansas. Yes, Rama. I bring you greetings from Arkansas. I have my bachelor's and master's degree from one from the University of Central Arkansas. And the master's is from the University of Arkansas at Medical Sciences School of Public Health. How many of you are the first in your family to earn a bachelor's and master's? Drop a 1 in the chat if you're the first in your family. I'm the family first to have my bachelor's, master's, and also the first to start my public health consulting firm. My bachelor's degree, I specialized in Spanish. I was bilingual back in the day. You know, if I had a conversational partner now, I probably would do really well. You know how that goes. I am the mother of 3. I've been a wife for 13 years, and we have all survived COVID. Yay, together, house of 5. How many of you have coworkers right there in your home and you're just pushing through with school? It's such a challenge, but we're making it. Raised in a 2-parent home, I would say out of all the jobs that I've had in my career, including public health, where I've worked for 17 years, cashier was one of my favorite jobs. Just seeing all those customers come through, worked at Walmart, Kroger. Drop a 1 in the chat if you've ever been in the customer service field working as a cashier. How many of you have been cashiers before? Okay, Ariel. Yes, so we got some cashiers out there. Retired from the Arkansas Department of Health with about 13 years of experience. I started off as a secretary just to get my foot in the door, making $8 an hour. And I moved through the ranks at the health department. And by the time I left there, I learned SAS on the job. I heard Maria talk about data visualization. I learned GIS on the job. All great opportunities, $8 to $25. And so, just talking about salary, I know when I was a student, I was always wondering, like, who's winning and who is not winning? Like, where is the money coming from? Because, after you graduate, you're looking for a position and you want to get paid. And so, that $8 to $25, it was a struggle, but, I made it. My current position, I currently work at Gainwell Technologies in my day job, and I also run a public health consulting firm. But if you asked anybody if my back was turned, what would they say about Latanya Bynum? It would be 3 words. Latanya is super resourceful, kind of like Dr. John. I'm super resourceful, always trying to figure out resources for the community. Very kind-hearted. I think that's, a Southern trait most of us have. But the Southerners, we go out of the box with kindness. Passionately curious, which means I'm just super nosy, y'all. That's all that means, super nosy. Next slide. What I'm here today to talk to you guys about is a opportunity that I have for at least 3. I'm looking for 3 interns. So here's my pitch. The name of my business is Ura Resource Center, LLC. I started this business January 2017. It is a public health consulting firm headquartered, home-based in Conway, Arkansas. I started the business as a result of my interest in public health, but then also my passion for creativity. My definition of public health is the art and science of making communities healthier. And what I'm doing with my business is really bringing that art back to public health, because I just remember doing so much, but a lot of my great ideas were shot down at the health department because it was not a part of my job description. So I was like, what else can I do? Like, I know there's, so much more. And if you look at the rankings for public health, you can see down south, we have lots of issues, right? And I think, for me, I was like, I'm challenged and I want to do more. I want to do more. And so this was my way of being creative. A lady reached out to me and she was like, oh, Latoya, we want you to come to Minnesota. Duluth, Minnesota, and do a public speaking engagement. And we want you to talk about what you're doing in Arkansas for your work. And, for me being, straight out of my program, for my MPH program, and her offering me a speaking engagement. And by the way, this was a paid speaking engagement. I was just so excited. I'm like, you mean you can pay me? And so, once that kind of struck, that I could do freelance consulting, public health consulting, and then also have my day job and it not be a conflict of interest, I was like, oh, this is right up my alley. And so the business, it really focuses on writing, public speaking, and research. The vision for the business is to improve the quality of life of all mankind. The slogan is to really just tap into your resources. How many of you are students and you just wonder, like, how do I use LinkedIn? How do I really engage my network on LinkedIn, perhaps using Hootsuite? How, should I set up my resume so that employers can pick me over everyone else that has an MPH? It seems like everybody's in school for an MPH now. And so the 3 projects that I have in mind for you, I just need 3 people to help me out. This is what I'm looking for, but I have three projects in mind. One is federal government contracting, certified community health workers, and then also helping me out with the geographic information systems. And the bonus is, if a student wants to just look at my website, you can pick one of the 40 programs that I have to choose from. Only 20 of the programs are generating revenue for my business, and the other 20 are something a client wanted me to do. So I generated money at least once, but there's really no energy or personal story behind that program. So I want to tell you guys, in the spring of 2019, I had my first intern from Benedictine University. Her name was Keltra Chandler. Somebody type in the chat for me, Keltra Chandler. She was my first intern. She reached out to me as a result of being a member of Black Ladies in Public Health, which is a Facebook group online and really is geared towards networking among African-American professionals who are looking for opportunities to really, innovate the field of public health. And so we came together and she reached out for me to do a resume. And, we worked on her resume and she got promoted and she was like, oh my God, I just love your energy. I want to be a part of your team. And I'm like, that's the reason why I left the health department, because I didn't want to become a manager. And I don't like being over people. I feel like I got 3 kids. That's enough for me. And so I was like, well, really, I don't know. She was like, no, it'd be great. It'd be great. And so we worked together, and through her internship through Benedictine University, I was able to work with her to publish. I know this is blurred out. Can you guys see it? I think it's blurred out, but I was able to work with her to compile my first book. It's called Tools for Career Success. And this book is really for public health students and new graduates and professionals to help them to figure out what in the world can you do with your degree in public health. And so through her internship, we were able to work on that book. And then just this fall 2020, if you could type this name in, Juanisha Bird, Juanisha, and both of them are on LinkedIn. Last name Bird, Byrd. So I'm telling you this because you can look to them for references to talk about their experience in working with me. we were able to work together, Juanisha and I, on ebook. My first ebook was recently published, and it's called The Opportunity Paperwork, just looking at her own resume and trying to figure out the ins and outs of how to set up a resume that can be used in multiple ways to create multiple streams of income. One of the things that Keltra is doing now, she runs a nonprofit organization called Fostering Faith. She's super successful with that as a result of just her passion and energy. But by working with me, we were able to kind of look at the resources available for her to start her nonprofit. And then Juanisha, she's currently interested in housing. She is really interested in affordable housing. And so she's really in Georgia taking on the housing initiative and looking at mobile homes and just providing affordable homes for people who are looking for that. So the position titles that would be available to you guys would be project management for one of these three, or any of the other programs that you see, but mainly these three is where my interest lies. For federal government contracting, I've been a state government contractor for the past 4 years. I'm a but I'm a vendor in Wyoming, Florida, Arkansas, and Minnesota. So I'm looking to use that past experience in using my woman-owned small business certification as a federal government contractor. So I need an intern really for that energy and then that zest and interest in what I'm planning to do next. This is a remote work experience only. Of course, I'm in Arkansas, and wherever you may be, you stay right there. And so we'll be working together remotely using Zoom, text, chat, Facebook. I have so many tools, and I'm sure you guys do as well, but this is a remote work opportunities. And it was really, I really pride myself on making the trainings very user-friendly. I'm big on train.org. If somebody can type that into the chat window, train, like choo-choo, train.org is a great place to learn new skills and COVID-19 procurement, communication courses, also HIPAA, that is a requirement for the internship, just taking that HIPAA training. And I saw someone had asked about Coursera trainings. Yes, there's a COVID-19 contact tracer training that I always encourage my interns to sit for and complete, and then also post that certification to their LinkedIn platform so that their network can see that. And really to gain experience, I'm asking that if you are looking for an internship and you're looking for a specific skill set that you want to have skills in and experience in, definitely consider Ura Resource Center as a one-stop shop for just, either mentorship or an internship. Now, of course, if you're doing the internship, there's some documentation required. I've already been through the process, so we can most likely work within that time frame in a matter of days to get that paperwork done. The other thing is, there's one more thing I wanted to tell you guys. Oh, this is what I tell all the interns. I can't afford to pay you. My business, I don't make a whole lot of money, but the thing is, what I'm asking you in return is for your time. I feel like, I've had 10 interns so far. I've subcontracted with Keltra and also working with Juanisha to work on resume referrals. And so we continue to work on developing your skill set as a business owner and also as a consultant. But what I'm asking of you guys is really to focus on, go to Indeed.com. This is your homework, even if we don't get to work together. Go to Indeed.com, type in the what field, type in $100,000. And in the where field, leave that field blank. And because remote jobs are everywhere, but what I want you to do is search for positions by pay and not by title, because like Maria said, she's spot on. These titles no longer matter, and public health is in almost everything. It's just a matter of figuring out what are the transferable skills. And so I want you to look at Indeed.com and search by pay for $100,000 paying jobs. and find out from those job descriptions, what are they requiring? What is preferred? What is a special preference? And what is looked upon highly? And then take that information, take notes like, ooh, they're looking for somebody who specializes in GIS, or, oh, they want a pharmacy, somebody with PharmD experience, or, you know, they're looking for specific things, or someone who works or have past experience in infectious disease control and prevention, something like that. And so what you're going to do is note those experiences, and then you're going to reach out to organizations and say, hey, you know, I want to work with you, I want to volunteer, and here's what I have in mind. Can we incorporate that into your project or your job description so that it's a win-win? And I would say from the past 10 interns that I've had, we always ask them to come in with a win-win, because I remember my internship, I was given a project. I was not happy with it. And so I think, you know, that creative energy that I have is best that I'm in a situation where it's something that I want to learn about, and then it also meets the needs of the organization. So that is what I have to say. If you can find me on LinkedIn, or also there's my email address at the top of the slide, reach out to me, but definitely look me up on LinkedIn and see what I'm working on and what I'm, currently doing, and see how we might come up with a win-win scenario. But on behalf of Ura Resource Center and the interns and subcontractors and all of my mentees here, I would like to say thank you and congratulations in advance on your degree, and thank the presenters as well.
Thank you so much, LaTanya, for that informational session there. We're going to move on to our next organization here. We have Megan from the Peace Corps. The floor is yours. Oh, I don't know if we can hear the audio.
I think you have to select share computer sound.
Yeah.
Be here in a recording tonight, even though I can't be there in person, just to share some information about Peace Corps, opportunities in the health sector, and to also introduce myself. So I'll start there. My name's Megan, and I'm the Peace Corps recruiter for Benedictine. Before I held this position, I was a Peace Corps volunteer, and I served in Ukraine in the education sector from 2018 until 2020. Now, some of you might be saying, what is Peace Corps? Well, Peace Corps is a 27-month volunteer program. We send volunteers to different countries around the world to meet the needs of the host country. So that includes 3 months of training plus 2 full years living and working and integrating into your host community. We have 2 basic hard and fast requirements, that you must be 18 years old or older. We have no upper age limit, and that you must be a US citizen. Now, it doesn't matter if you were born a citizen or if you recently became one. All that matters is that you have that status by the time that you're ready to become a Peace Corps volunteer. Now, while those are our 2 basic requirements, competitive applicants are going to have a little bit more than that. A college degree or 5 years of professional full-time working experience, as well as a tailored federal resume. Now, here's where I can come in to help with resume review, templates, and samples that can really help you in crafting your federal resume. You may also want to get some volunteer experience or highlight that on your resume if you already have it. And then do some research about Peace Corps. We have an awesome website with stories from returned volunteers, information that is sector specific, and lots of virtual events that you can attend and register for right online. So do a little bit of research and explore our website some. Then lastly, you're going to want to be as flexible as you feel comfortable with when you apply, and you're going to want to apply early. So there are 2 ways of submitting your Peace Corps application. The first is to apply to serve where you're needed most, And that just demonstrates complete flexibility. You're saying that you want to go to whatever sector and whichever region of the world where you are most needed. However, you can also apply to a specific position. And then within that application, you'll have a chance to explain or to list your flexibility if for some reason you aren't chosen for that position. And I say apply early because typically in a normal year, we have application deadlines that happen once every 3 months. Right now, we're taking applications on a rolling basis, but we're still encouraging folks to apply about 9 to 12 months before they're hoping to depart. Now, in this top left corner, you can see all of the program area concentrations that we have. These are also called sectors, and there are 6 of them. So these are the categories that Peace Corps volunteers can apply to. These are the types of jobs and the types of work that volunteers do, and health is one of them. Now, in the bottom right corner, you'll see that health is actually one of our largest sectors. It is the second largest with about 20% of our positions and our volunteers working in that sector. So health volunteers do a variety of jobs, health education, HIV and AIDS education, nutrition, maternal and child health. These are all things that are part of the health sector. And if you do decide to apply to a specific position, you'll be able to find out a little bit more information about what that position is like within the description. Some of these things are also going to depend on what your community needs are. So that's the really great thing about Peace Corps service is that it is what you make of it. And there are lots of different projects that you can do and initiatives that you can start within your community. Now, I want to take a moment to highlight some of the benefits of service. There are so many intangible benefits like the relationships that you'll build and that feeling of being part of a community. And I could talk about those for days. But right now, I'm just going to talk about the tangible benefits that you have as a volunteer. The volunteers receive a living stipend and a housing stipend every month. And while Peace Corps is not going to make you rich, you are going to be able to live comfortably within your community. You'll also get medical and dental coverage. You'll have access to doctors 24/7 that you can just call up or shoot an email to. And then the benefits after service are really great as well. So first up, you'll see about $10,000, and that can be spent however you'd like. But you also have graduate school opportunities like the Coverdell Fellowship. And my favorite is the professional and personal networking. Returned Peace Corps volunteers, there are about 250,000 of us, have formed groups all over the country and all over the world. And it doesn't matter if you served in the same country or sector or even in the same decade, returned volunteers are, in my experience, always willing to help with professional networking or finding a new apartment in the city that you just moved to, and really just being a friend. Now, I know that was a lot of information. You may have some questions, so please feel free to reach out to me either via email or phone. All my information is there. I also really encourage you to check out our social media and our website because we are really active online. Especially right now, you can attend so many events that are going on virtually, and those are really great sources of information as well. So I'm looking forward to hearing from you very soon. If you have any questions, don't hesitate to reach out.
All right, awesome. We're happy that Megan was able to record a video for us to share today. And we will also make sure to share all the contact information for our panelists with all of you afterwards. We've also, I think, already dropped a link in the chat for our LinkedIn group we've actually created for all of us to connect afterwards. And panelists, we also encourage you to join that so our attendees can connect with you and on LinkedIn and stuff. So we have those in the chat. We'll also share the link obviously a couple more times before we end the session today. With that, we're going to move to the next panelist we have. I believe, I think it's, yes. So Samyukta from American Association of Nurse Anesthetists. Go ahead.
Thank you, Aishwarya. Good evening, everyone. My name is Samyukta Gumidyala. I am the State Association's Relations Manager Level 2 at the AANA, or the American Association of Nurse Anesthetists. I received my MPH at Benedictine in 2013, and I've been at the AANA for about a year and 3 months. And before I started working at the AANA, I was a program manager at the American Osteopathic Association for 4 years. And my first job out of grad school from Benedictine was working at a Center for Independent Living, a social services organization for people with disabilities. Next slide, please. So the AANA, again, American Association of Nurse Anesthetists, we are the professional home, the professional membership association for CRNAs. And CRNAs are certified registered nurse anesthetists, and I'll tell you more about who they are and what they do. We have over 57,000 CRNAs and student registered nurses that we support nationwide. Our mission is that the AANA advances patient safety and our profession through excellence in practice and service to members. Our vision is that the AANA is a transformative leader driving innovation and patient-centered excellence in anesthesia and healthcare. So because we are a professional association, because we are a membership association, our strategic plan, our executive decisions to run the association to support our members is mainly made by the AANA Board of Directors. So the Board of Directors are volunteer CRNAs committed to promoting the mission of the organization, as well as we have AANA, various AANA committees and AANA affiliates all working together to advance the mission. So our main office is in Park Ridge. That's where our headquarters is, right next to Rosemont in the O'Hare area. And we have a federal office in Washington, DC. And we're a small but very diverse organization of 127 staff members working in various areas, providing various services to support our CRNA members. Next slide. So who are CRNAs? So when I first came onto the organization, I needed to learn how to pronounce the word anesthetists properly before I would totally mix it up or totally mess up. But they are certified registered nurse anesthetists who provide anesthetics to patients. So those of you who've had surgeries in the past, you might have had anesthesia either done by a CRNA, a nurse anesthetist, or an anesthesiologist. So anesthesia is provided in collaboration with surgeons, dentists, pediatrists, physician anesthesiologists, and other qualified healthcare professionals. And actually more than 80% of the anesthesia providers in the rural areas are CRNAs, because CRNAs are generally more cost effective than the doctors, than the anesthesiologists, but they are equal to anesthesiologists in that they provide the same safe, high quality, and cost effective delivery of care. And they practice pretty much wherever anesthesia is delivered. And like I said, we have over 57,000 members of the AANA. And one thing I wanted to mention is that they're very passionate people. They're very smart. They're very passionate about their job. They're passionate about their patients. And you might have seen that they were definitely in the spotlight during the pandemic, during COVID, because these CRNAs are definitely on the front lines administering the patient care. Because what happened was they were heavily impacted but where many CRNAs, were furloughed, they lost their jobs because we were not doing elective surgeries anymore. So those CRNAs, sometimes if they didn't lose their job, or if they got their hours reduced, they were basically put on the front lines. They were put in other areas, especially in the ICU, because they are fully trained nurses who specialize in administering anesthesia. So you'll also see, if you're interested in, healthcare policy, federal work, government work, influeing in legislation, health policy, healthcare delivery, CRNAs are definitely constantly fighting, legislative battles, with the anesthesiologists, because you might have seen in the news that during the pandemic, we temporarily, removed supervision. That means, CRNAs don't need to have, supervision of an anesthesiologist to provide the care. So this organization is definitely very heavily advocacy focused to help CRNAs achieve their legislative battles and, get supervision removed or have more basically scope of practice expansion and practically prescription authority and all kinds of legislative healthcare practice rights. Next slide, please. So right now, if you go to the link below, the WANA.com ANA careers, you'll find the job opportunities that are available. I do have to mention, currently we only have one job opening right now that's available. It's an accounting manager position, but I do want to mention that if, because, Benedictine does offer a dual MPH MBA program, you might want to consider applying, especially if you have accounting experience. But what I do want to mention is that because public health is so broad, you can utilize your public health degree, the transferable skills in all these various areas within the organization. So the different services that we offer, to the CRNAs is, continuing education, professional development, governance, health operations administration, project management, which is important in public health, IT, membership, healthcare advocacy, like I've mentioned, research, that is a big thing. We have, the ANA Foundation, which is the philanthropy arm of the ANA, and, public relations. Public relations is really big in, really increasing the CRNA's presence and with communications and marketing. I specifically work in the state management affairs, where you could say my position is similar to like chapter relations, but with state associations. So we provide financial assistance, consulting, services, management services to the various states. And so one thing I also want to mention is that even though we're not directly, providing patient care or directly doing specific, public health, what's important to know is that we're still making an impact because we're supporting these healthcare professionals do their job better, and so that they can be better caregivers, they can be better providers of healthcare to their patients, and that they can be better leaders of the profession. So another point I wanted to make is that we are an association, basically like a member, because we're a membership association for healthcare professionals. You will find similar associations all across the country, like American Academy of Pediatrics, our previous presenter is an association, for, the pediatric, physicians, and just Chicago itself is a hub of associations. And I, came from the American Osteopathic Association for osteopathic physicians, and you probably have heard of the American Medical Association, the American Dental Association, the American Hospital Association, and they're all in downtown Chicago. So definitely, if you have an interest, in healthcare administration, research, advocacy, and policy, definitely check those organizations out. What I'll do is during the meeting, I will put a link to the association forum, which is basically the umbrella of all associations. And the funny thing is, it's like there's literally like if there's an association for everything, like there's even, American Library Association, or even certain specialties of healthcare professionals will have an association as well. So, so I hope that you'll be able to find something that works for you. And I also want to share that when I was doing my MPH, I wanted to work in a hospital. I had a vision of becoming the CEO of, a hospital and, working in, administration there. Then I, started an internship in, the nursing administration office in Joliet at present St. Joe's. And then I moved into clinical research, and here I am in association management. I've found my calling. I love this job, and I love, working with members. And this organization is such a great place to work. We're very much valued. The employees are very much valued. Like, we really care about the work we do, especially because the members, the CRNAs, are passionate themselves. So definitely when you're doing your internship, don't think that that's where you're going to end up. Definitely keep an open mind, because you definitely want to be prepared for those changes. And so where you started with before may not be where you end up, maybe 5-10 years down the road. So next slide. So thank you again for giving me the opportunity to speak to you about the AANA. If you have any questions, feel free to message me on LinkedIn. I will also accept any, messages to my email. My email is right there. And again, I'll feel free to ask me any questions in the chat, and I'll also send you the link to the association forum if you're interested. Thank you again.
Awesome. Thank you, Samyukta. And then we have our final panelists for the evening before we have some time for questions from all of you who are attending. We have Abdullahi from the CDC PHI Fellowship. Go ahead.
Thank you. Thank you. I don't know how I can beat all those great programs and great organizations that have presented for me, but I'll try. Good evening, everyone. Welcome to the PHI CDC Global Health Fellowship Program. My name is Abdullahi Farah. I am the University Liaison Program Officer for the Consortium of Universities for Global Health. My background is also public health. I had my MPH from the University of South Dakota and worked in a number of years in the social determinants of health before I joined CUHEH in Washington. So this program is a great way to begin your path into the global health, and we're delighted to be in a position where we can facilitate that. The PHI CDC Global Health Fellowship Program supports the CDC's role as a leader in response to the global health needs and challenges by offering competent and well-educated early career professionals training opportunities at the front lines of public health. And that's actually true now more than ever, that we have the worst pandemic since 1913. In this fellowship, the PHI, which is the Public Health Institute, and the CDC Center for Global Health, in conjunction with the CDC offices worldwide, work together to develop this program and fund and also implement. The PHI is the prime implementer of this program. PHI is a nonprofit healthcare organization with over 200 healthcare programs in the United States and around the world. And they oversee the day-to-day operations of this fellowship. And they formed a partnership with the Consortium of Universities for Global Health, which is the organization I work to support the fellowship in the areas of outreach, which is what I'm doing now, professional development once the fellows are onboarded. So to apply for this program, applicants must meet two major eligibility criteria, one of which is that you have to be a US citizen or a lawful permanent resident of the United States. The second major eligibility criteria is that you have graduated or about to graduate from CEPH accredited institutions. CEPH is abbreviated from the Council on Education for Public Health. And you should be able to have one of three degrees, which is MPH, MSPH, and PhD in public health. In fact, they just added the MSPH this year. For a number of years, the CDC has been, contemplating to consider MSPH as equivalent to the MPH. So now we have those 3 degrees admitted into the program. So the application, can you go to the next slide, please? So the application window open is mid-December every year, and it's only open for a few weeks. So I would definitely advise the students who are interested in this fellowship to go into our website and sign up for our mailing list so that you will get notified once the window opens. And once the application window opens, please go to the website, create a profile, fill out the application, select one of the 6 tracks that we have in this fellowship. And the 6 tracks are epidemiology, HIV prevention, program management, monitoring and evaluation, strategic information and surveillance. And I would advise you to decide one of those tracks and make sure that your application and resumes are in line with whatever track you're interested in. I also would like to tell students, please pay specific attention to essay questions, to the essay portion of the application, because that's where they are asking you about your motivations and what would eventually make you a potential viable candidate. Believe it or not, the average number of applications that we receive every year ranges from 400 to 500 for only 25 to 30 positions. So please be intentional when you're filling out that application, and specifically in the essay part of the application. So once the application window closes, mid of January, we go into the review phase of the application process. And this spans from February through April. And we have the Global Health Workforce Panel, and these are professors and instructors from CEPH accredited institutions nationwide, and they have a specific experience in one of the 6 tracks that I have discussed earlier. So they will individually review each application and they will grade each application. And then the highly graded and highly scored applications are then submitted to the CDC, and the CDC will conduct further evaluation, finally segregating the highly potential applicants, and they will invite them for interview and conduct that interview. And once they conclude, they will resubmit that list back to the Public Health Institute, who will then reach out to those applicants and inform them about the status of their application. So from there on, we will invite the successful candidates to both online and in-person orientation, where they will be educated about the location where they will be assigned to. Historically speaking, 35% of the candidates will be assigned here in the United States, and mainly in Atlanta, Georgia, where the CDC headquarters are, while the 65%, about 65% will be assigned to some post somewhere in the world. Some of the countries that we currently have fellows include Kenya, Malawi, Zimbabwe, Cameroon, Guatemala, and South Africa. So this is a year-long fellowship. However, fellows do have the opportunity to extend for up to 3 years. They can either renew in the very same placement, or they can request to transfer to a different CDC field office within the same country or other overseas countries. Each fellow will be embedded with 2 CDC experts who will provide mentorship and guidance and day-to-day help throughout their fellowship year. Fellows will receive a predetermined monthly stipend based on the GS scale. They will also receive allowances, including traveling, training, housing, and healthcare. I wish I did prepare way longer than these 2 slides, but I think given the amount of time that we have left, it's fitting. If you have any questions, please go to our website, www.phi-cdcfellows.org, or you can email us at info@phi-cdcfellows.org, and we will be more than happy to assist you. Thank you.
All right, thank you so much for all your presentations. I believe that was the last one. We are opening up the ground to questions, and we do have a couple of questions that were asked in the chat. And the first question comes from Rama to the presenters. What according to you makes an application stand out?
Since I was the last speaker, I can take that question, I think.
Thank you.
For this specific fellowship, I think they look for 3 things, and that's a strong academic background, a strong professional background, and you have to have a strong sense of global health perspective. As I said, you will be deployed somewhere in the world, and They just want to understand that if you chose epidemiology, that you have a background in biology and do possess a substantial amount of knowledge and understanding what that entails too. So I think those are the three qualities that we look for: strong academic background, a strong professional background, which means that while you were in school, you were able to volunteer at the local public health or the local state, health, and have spent a good amount of time understanding the dynamics of healthcare, not only from the clinical perspective. So having that kind of qualities absolutely makes you a viable candidate for this fellowship.
Thank you so much for your detailed response. And another question is, can anyone answer, how do you react to applications that have learned skills from courses on Coursera and other educational services such as Coursera? Can you care to elaborate?
This
Was
is
that-
Tanya Bynum. I just wanted to share that, I'm a train.org junkie. I believe that CDC really prides itself in sharing public health resources through train.org, which offers a lot of continuing education professional hours. I know that I'm a certified health education specialist, and so that is a location where I get a lot of my additional CUs for continuing health education hour credits for my profession. I would say that Coursera training, hint COVID-19 contact tracing, I've seen that several times on LinkedIn posted. And then if you look in their employment history, you'll see that they're actually a contact tracer for either a contracting agency or the state health department. And so what I'm saying is, yes, definitely, get your master's degree in public health, but then also use those courses online to develop out your niche, because, like everyone said, public health is so broad. There's so many things you can get into, but those trainings are a plus, especially for my organization. That is the #1 source of where I direct my interns, and also for my mentorship program, I also direct a lot of my mentees to that training. And so it's a yes for me. And if I see that on your resume, I'm going to say, oh, you already have a profile on train.org. That's great. So that's a little bit for Ura Resource Center, LLC.
Awesome. And I believe our Dr. Krishna Bagat also mentioned train.org as well. So we have two sources saying pro train.org. That's great. And a question from Jillian. Samyuthka, did you do your MPH online or in person? Did it feel like it prepared you for your first job in public health?
Good question. Yes, I did my MPH in person. I commuted. I lived just 20 minutes away from campus, so I commuted, every evening that I had a class, and it made such a difference because having that, face-to-face time and office hours, with the professors, and really taking that opportunity to ask questions, to really sit with them on office hours, especially, I'll never forget, like in the biostats class, if those of you remember Dr. Bailey, like that was a class where we definitely worked together and like go to her office hours to really figure out the problems and work on the projects. And what I learned was that everyone wanted to support each other succeed. Everyone wanted to help each other get their degree, get the jobs, get the internships. And I think definitely making those connections with the professors, really developing those relationships. They see your skills, they see your desire and passion to make a difference in public health. And one of the other things I was involved with, we actually, before this became the Public Health Student Organization, we had what we called the MPH Student Advisory Panel. So when I was getting my MPH, I actually was president of the panel for 1 year. So we did a networking event similar to this, but it was in person. We did a lot of public health events in the community. And so one of the professors, she taught a course in cultural competency. And maybe some of you remember Professor Betty Lawrence Water. Like, she was having that connection with her. She helped me get my first job. at the Center for Independent Living, because she was happened to be on the board of that organization. So really, definitely going in person, really making those relationships with the professors, having those connections really made a difference.
Thank you so much for your answer. And I do agree that networking is so important, as I've got some great references from professors, one being in this room, Dr. Krishna Pitt, and my recruiter, Emily Janacek. So all for full circle moments. Thank you. All right, does anybody have any other questions that they would like to ask our presenters? Okay, with that being said, we have this concludes our Benedictine annual public health session. And just wanted to let you all know that in the chat, we have dropped our social media channels, our Instagram, Twitter, Facebook, and then LinkedIn. And we see a lot of you have joined LinkedIn already. There is a group in there for this specific conference. Please join if you would like to network with anyone else in this group. And that is all. Thank you. Oh, and lastly, my apologies. There's also an evaluation for tonight's presentation that we have also dropped into the link as well. Thank you.
Yeah, I just want to hop in and thank all our presenters. Thank you so much again for all of your really invaluable information that you've given all of our attendees. I know we're getting so much, you guys are getting so much love in the chat. So thank you so much for taking time out of your day to be here. And yes, everyone, please make sure to join the LinkedIn group. We're all going to connect on there, presenters as well. We encourage you to join to connect with many of our attendees here. So yeah, we hope to continue our conversations in there. And thank you all for joining us this evening.
Thank you for having us.